Welcome to Medicine Handy Point. Today we will discuss a case in which a patient will present to the clinic with back pain. So we'll take the history, how to take the history of the back pain. So we'll start with the age of onset is very important in this, because if the patient is less than 40-year-old and the patient is complaining of back pain, then ankylosing spondylitis should be kept in mind, especially if the patient is male. So that's very important. Then we will ask as usual about the onset of the pain. If it is acute onset of the pain, so keep in mind disc prolapse and spinal cord compression, because disc prolapse, spinal cord compression, and Cauda equina syndrome. In spinal cord compression, you will get upper motor neuron signs in lower limb, while in Cauda equina syndrome, you will get lower motor neuron sign in lower limb. So acute onset, always suspect disc prolapse, spinal cord compression, Cauda equina syndrome, which can occur because of the disc prolapse or vertebral fracture. So keep that in mind. If the presentation is subacute and gradual in onset, then we keep in mind infection, inflammation, malignancy, and some metabolic causes should be kept in mind. Then we ask about the progression. Progressive disease occur in ankylosing spondylitis and malignancy, either primary malignancy somewhere in the spine or secondary to the spine. Then, as usual, we will ask about the characteristic of the pain. So we'll ask about the site of the pain. If the pain is in the lumbar region, we'll ask about radiation to the lower limb, and if the pain is in the thoracic region, we will ask about radiation to the interior chest. So the site of the pain is very important, and then the radiation. Sometime the back pain is referred pain, like originally it will be a peptic ulcer disease pain, or pancreatitis pain, or dissecting aortic aneurysm, abdominal aneurysm pain, and it will be referred to the back. And so originally the problem is somewhere else. Three diseases causes refer back pain. One is peptic ulcer disease, second is pancreatitis, and third is dissecting aortic aneurysm. These causes refer pain to the back. So we'll ask whether it is the original insight of back pain, or it's a refer pain to the back. Then we will ask about the nature of the pain, whether it's a dull, sharp, electric shock like. Electric shock like actually occur when the nerves are compressed or the spinal cord is compressed. We'll ask about the severity of the pain, mild, moderate, or severe. Then the radiation of the pain. If the back pain, it is bilateral radiation to the legs. It could be spinal cord compression or Cauda equina syndrome. They causes bilateral radiation. On the other hand, if the radiation is to the anterior chest, from the thoracic vein anterior chest, there will be anterior chest radiation of the pain. Sciatica pain usually radiate below the knee joint, and then we will find out the lower limit of the pain, and if it falls in L5 dermatome, it means that the disc prolapse is at L5 region. So it will help us guide the level of disc prolapse as well. Then we'll ask about the, as usual, aggravating factors. Coughing, sneezing, straining, and movement aggravate disc prolapse pain, while spinal cord compression pain is always like whenever there will be too much strain on the back, the symptom will aggravate. So again, straining, sneezing, coughing, movement will aggravate spinal cord compression, disc prolapse pain. Walking a fixed distance, like if the patient develop a pain after a fixed distance, is usually a spinal stenosis pain. ask about the relieving factors like taking rest, sitting or bending forward relieve the pain of the spinal stenosis. So we should ask that. Pain which is not relieved by lying down could be a malignancy or infection because they don't get relieved with the rest. Alarm symptom in the back pain are very important, so we'll keep in consideration the age of the patient. Age more than 50, we should raise the alarm for plague. History of malignancy is important. Fever, weight loss, night sweats important in case of tuberculosis malignancy as well. Duration more than 1 month of back pain is should raise the alarm. Lack of response to analgesic should raise the alarm. Night pain, uh, usually a malignant lesion causes night pain. Neurological symptoms like sensory motor abnormality, urinary fecal incontinence, or retention or gait abnormality should raise the alarm. Now, then we will ask few questions to rule out rheumatological condition which causes back pain. So the initial is ankylosing spondylitis. So we will ask about neck and back pain. We'll ask about red eyes. It causes anterior uveitis and shortness of breath because it's called apical fibrosis. So it will point toward ankylosing spondylitis. We'll ask about small joints involvement, rash and nail changes which will point toward psoriatic spondylitis. We'll ask about increased urination, pain in epigastric with radiation to the back because and symptom of hypercalcemia. This hypercalcemia actually causes pancreatic and peptic ulcer disease as well. Pancreatic in the sense that it causes pancreatitis and there will be pain in the epigastric radiating to back, and it hypercalcemia causes peptic ulcer disease as well. Hypercalcemia causes constipation as well, abdominal pain. So we'll ask about that, which will point toward multiple myeloma. Multiple myeloma has special predilection to cause lytic lesion in the back. Past history should include any malignancy. Tuberculosis is very important because it was the back. Osteoporosis in the past. We'll especially ask if the patient has any use of steroids in the past. Family history of osteoporosis and oophorectomy in past should be asked. Medication steroids causes osteoporosis and back pain. Family history should be sought in context of osteoporosis. It runs in family, ankylosing spondylitis and psoriasis. It also runs in family. Social history will ask about the occupation and any injury during workplace occupation, because if the patient is a manual worker, is prone to degenerative spine like osteoarthritis. So we'll ask about that. Injury during workplace can lead to spinal cord compression, disc prolapse, and we will ask about the impact of the back pain on daily life activity and workplace activities. We'll ask about smoking and alcohol as both leads to osteoporosis. So this is all about the history of back pain. I hope you like the video and please subscribe to the channel.